Hello. This video should last just 8 to 10 minutes, but in the time it takes you to view it twice, somewhere in America, a person will have died from an opiate-related cause. This video training will present an overview of the medication known as Buprenorphine, used in the brand name drugs known as Subutex and Suboxone. Buprenorphine is included in the class of drugs that affect the brain and central nervous system that was discussed in Module 3. Buprenorphine is used in medication-assisted detoxification of opiate addicts. This training is intended for registered nurses who work with addiction in psychiatric settings. There are 3 learning objectives. The first is that after viewing the video training, nurses will be able to accurately restate the basic facts related to the scope and impact of the nation's opioid epidemic. Second, after viewing this training, nurses will be able to describe and explain how the medication buprenorphine works pharmacologically to precipitate or speed up withdrawal from opiates and reduce cravings for drugs. Third, nurses will be able to identify side effects and contraindications for buprenorphine use and apply this knowledge safely and effectively to patient care. You may have heard the term opioid epidemic. Our country has been in the midst of one for the last several years. Opioid-related deaths include the oral and/or intravenous use and abuse of illegal drugs, such as heroin, as well as prescribed medications, such as morphine, oxycodone, hydrocodone, hydromorphone, fentanyl, tramadol, and codeine. We often think of epidemics in terms of medical diseases, such as influenza, Ebola, or the Zika virus. But opiate-related deaths have created an epidemic of a different kind. In 2016, an average of 116 people died every day from an opioid-related cause. If you divided that by 24 hours and then into minutes, you'd find that that's why at the end of my 8 to 10 minute video, watching it twice, someone could have died. These deaths include overdoses, intentional as well as accidental. Today, the #1 cause of death among those under 50 years of age in the United States is opiates. That's right, opiates. Not cancer, not heart disease or diabetes, not suicide or car accidents. It is estimated that 11.5 million people misuse prescription opioids each year. There are 950,000 heroin users in our country. 2.1 million people diagnosed with an opiate use disorder. And an economic cost of $504 billion annually. Buprenorphine-based medications are the first line of defense for detox and treatment. Buprenorphine is classified as an opiate receptor partial antagonist. It acts by binding tightly to the mu opioid receptors on cells in the nervous system, the central nervous system, and by blocking the use of other opioid receptors, so other opiates cannot be used by the person. Mu opioid receptors mediate the body's perception of pain and can result in feelings of euphoria, as well as suppress the respiratory system. As someone becomes more tolerant to opioids because of repeated use, the mu receptors become less sensitive and require more and more opiates to produce the same effect. This is known in addiction as an increase of tolerance. When enough opioid receptors are not stimulated, the patient experiences discomfort and undergoes withdrawal with a multiple amount of symptoms. When an opiate receptor is filled with a full opioid agonist, such as heroin or morphine, it stops the withdrawal for a period of time and results in feelings of euphoria. Eventually, the brain begins to crave opioids, and it leads to a vicious cycle of addiction. When buprenorphine, a long-acting partial antagonist, is taken orally, it is a, quote, imperfect fit on the receptor, meaning in some receptors it binds more tightly than heroin and other opioid agonists, and actually expels other opiates, such as heroin, on the receptor to help withdrawal. In other areas of the receptor, it simply blocks out other opiates and prevents them from attaching. Buprenorphine does not provide the feelings of euphoria and won't lead to addiction. Finally, 24 to 72 hours after the last use of buprenorphine, there are still some limited opiate effects, preventing withdrawal symptoms and continuing to block other opiates. Nurses assess patients detoxing from opiates with a doctor-ordered clinical opiate withdrawal scale, or COW, that measures vital signs and other subjective and objective withdrawal symptoms. These include muscle aches, nausea, tremors, feelings of flushing and sweating. When a patient reaches a certain level of detox, approximately 24 hours after their last use of opiates, and gets an appropriate score, the doctor will start the first phase of buprenorphine, the induction phase. Initiating the first dose of buprenorphine too soon could result in an overdose. Common side effects of buprenorphine include hypotension, decreased respiratory rate, drowsiness, headache, nausea, and constipation. Contraindications include liver disease, pregnancy, urinary problems, traumatic brain injury or brain tumor, and Addison's disease. Serious but rare side effects you should be aware of include pinpoint pupils, signs of an overdose, blurry vision, dyspnea, confusion or change in mental status, and a respiratory rate less than 12 per minute. Other nursing care considerations include spacing benzodiazepines such as Ativan and Valium at least 2 hours apart from buprenorphine doses, assessment and treatment of alcohol detox, assessing and intervening on fall risks due to drowsiness, and remaining NPO or nothing by mouth for at least 10 minutes before and after the dose is given. Orally disintegrating tablets of buprenorphine may take as long as 20 minutes to fully dissolve. Opiate addicts who do not continue with further treatment have a very high relapse rate, but a safe medical detox is the first step on the road to recovery.